Hey, how you doing? Thanks for tuning in. Well, as you probably remember last week, I shared with you a basic introduction of functional cognition and the difference between that and traditional cognitive rehabilitation. And I also introduced how to screen for functional cognition issues through the use of real life occupations. And today I shared with you some further insight on how to do a more thorough activity analysis through using the phases of functional cognition. And I also introduced how to do formal assessments, formal standardized assessments. And now I thought I would go into a little bit more detail about that and talk about some traditional cognitive assessment tools. And then I can go over a little bit about my favorites. So, in the OT world, there are a lot of formal standardized assessment tools that help quantify cognition. There's the MoCA, the Montreal Cognitive Assessment, the SLUMS, the St. Louis University Mental Status Questionnaire. There's also the Mini Mental State Exam. There's a plethora of those that will tell us where on the cognitive spectrum the patient might be. For me personally, the past 5 to 10 years, I've been using what we call the Brief Cognitive Assessment Tool, or the BCAT. And I like it because it's very detailed. It's a 50-point test. It takes about 10 to 15 minutes to do, and it gives a very good composite score of where the patient is on the grand scheme of things on the cognitive spectrum. It tells us mild cognitive impairment, mild dementia, moderate dementia, and also severe dementia. And that's very useful because it helps us to know where to start therapy, whether the patient would benefit from errorless learning, where they would benefit from error-full learning, or traditional learning. And also, based on correlational tests, it tells us the likelihood of whether the patient will be safe to be by themselves alone or not. Because the patients who score less than 25 or at a moderate to severe dementia generally will need 24-hour care. And patients that score above that level through correlational studies have been shown to do better at home on their own with less supervision.